Welcome everyone to the NIOSH Total Worker Health webinar series, The Employer Pathway to Diabetes Prevention. Free continuing education credits are available for this presentation through CDC Train. We're pleased to be able to offer a variety of continuing education types, including CME, CNE, CEU, CECH, and more. Note that the bright blue activity number is only valid for those watching the live webinar, and you'll need the course access code to receive credit. That's on your screen now. The gray activity number is to be used only by those who view the webinar recording or attempt to access continuing education after February 26, 2024. We plan to record this webinar and we'll post it on the Total Worker Health webinar page as soon as possible for those who couldn't join us today. Today's featured presenters are Sara Hanlon, Parul Rahbari, and David Shapiro. Sara Hanlon is a consultant with the National Association of Chronic Disease Directors, NACDD, where she is the employer coverage subject matter expert for the National Diabetes Prevention Program. She provides technical assistance to employers and other commercial organizations interested in adopting and covering the National DPP's Lifestyle Change Program. Parul Rahbari is a senior project officer on the state and local consultation team in the Division of Diabetes Translation. She provides technical assistance and training to national organizations to scale and sustain the national DPP. In her role, she assisted the state and local health departments in incorporating their diabetes prevention work with employers to gain coverage of the national DPP as a covered health benefit. And last but not least, David Shapiro is a senior manager of programs and partnerships at the Center for Health, Work, and Environment, CHWE, also a NIOSH Center for Excellence for Total Worker Health, and manages the day-to-day operations of CHWE's signature public health outreach program, Health Links. In this role, he consults with the organizations in the Health Links Healthy Workplace Network, sharing resources and recommendations to help them implement a total worker health approach and support the health and safety of their teams. And with that, I am going to pass it over to Sara to begin our presentation. Thank you.
Great, thanks so much, Sara. Not sure I have control of the slides again. If you could make that available as we get started. There we go. Thank you. All right. Thank you for the great introduction, Sara. I think we're at a great point right now with our ability to have conversations like this with work sites across the country. I feel very fortunate to be able to do that. And as we come into these calls, my goal, if we walk away with a handful of benefits professionals who really hear what we are putting forth and decide to take action, that's a win. Of course, we have really lofty goals, so we hope more of you will really see the value in this and see how it applies to your organization. But again, just appreciate this opportunity from the NIOSH Total Worker Health team. So let me go ahead and just share a little bit about what we will talk about today. I'll share just a little bit of background before turning it over to Parul, who will share more about the business imperative of diabetes prevention and really where CDC's focus is around diabetes prevention. I'll be back with you a little bit later to tell you about a new tool that is available to you called Helm and our diabetes prevention pathway within that and how that can support the work that you are doing within your own organization. We'll then have a chance, as you heard, to hear from David from Colorado, from Health Links. He'll share a little bit more about the work that they've been doing locally and kind of bring to life a little bit maybe of this story that you hear earlier throughout the presentations. It's important to us that we are receptive in hearing your questions and really being responsive to that. So we will spend a good portion of the call, about the last 20 minutes, on questions and answers and facilitated discussion. So as we're going through this, please do take note of questions that come up. Again, you can go ahead and drop them in the Q&A whenever you would like to, but also jotting those down can be helpful for the end. So All right, let's go ahead and get started. So before I hand it off to Parul to really get into the meat of what we're here for today, I did want to give just a little bit more context about who NACDD, or the National Association of Chronic Disease Directors, are, who I am, why we're here. So NACDD, I've been a consultant with for about the past 7 years, and I've been leading a number of worksite health initiatives, starting off with Work at Health for smaller organizations, and then really focusing in on diabetes prevention for the last 5 or 6 years. NACDD is the Association for Chronic Disease Directors and their staff across the country. So we have representation in all the states and territories, and provide services such as peer learning opportunities, policy support, leadership development, and knowledge exchange, to name just a few. If you're interested in learning more, our website is chronicdisease.org, so you can learn a little bit more about the other projects that we have underway. So specifically, NACDD got involved really deeply involved in worksite health and diabetes prevention back in 2018. So this was my first opportunity actually to meet Parul. We were in Atlanta together, sitting around a table with a lot of other subject matter experts and thought leaders, trying to figure out how do we really bring benefits teams, wellness professionals, and work sites into the mix for diabetes prevention and get those individuals on board. We knew a lot of states were really working on this as well, so we wanted to create a model that states will be able to use to better engage with individuals like those that are on the call today, to provide a little bit more support in understanding what prediabetes is, why it should matter to your organization, and then how to design a benefit that's responsive to that. Over the period of about 4 years, we engaged 25 state health departments, 9 self-directed participants, and 5 national organizations that went through a really intensive 18-month training and hands-on support opportunity that gave them the skills that they need to be able to work directly in the field and support benefits teams in diabetes prevention efforts. Out of that work, we took those learnings and created Helm, which you'll hear more about a little bit later today. But again, I wanted to share this background just a little bit up front so that you understand why public health is here so much at the forefront in this diabetes prevention space, and where we're getting these thoughts and ideas and concepts and structures from. So with that, Parul, I'd love for you to jump in. I know you'll touch a little bit more on the ELC and what that felt like from the CDC perspective as well.
Thanks, Sarah, and happy to be here today speaking to the total worker health community. The Division of Diabetes Translation, or DDT, is located in the National Center for Chronic Disease Prevention and Health Promotion at the CDC. And so it's really nice to be here with NIOSH, bringing different parts of CDC together. Here at DDT, we've been thinking a lot about our priorities over the last year because we have just released our new 5-year strategic plan. Our key priorities from the plan for the next 5 years focus on diabetes prevention, risk reduction, and management. And thinking about prevention, we're focusing our efforts on both individual prevention and population prevention by working to mitigate the impact of social and structural determinants of health that contribute to the onset of type 2 diabetes. Businesses and organizations can join CDC in its diabetes prevention efforts in several ways, and you are all important partners in this work. Many of our participants today may already be working to reduce the burden of type 2 diabetes in this country, but others of you may not be as familiar with the trends. So I want to share a bit more about the current rate of type 2 diabetes and the effect that has on health and healthcare costs. And the iceberg is just a visual that we've used for several years now of what we see, but what's actually going on underneath. More than 37 million Americans have diabetes, which is about 1 in 10 people. In adults, type 2 diabetes accounts for about 90 to 95% of all diagnosed cases of diabetes. Additionally, 96 million American adults, or more than 1 in 3, have prediabetes, and more than 8 in 10 of adults with prediabetes don't even know they have it. We also know that people who have diabetes are at higher risk of serious health complications, including blindness, kidney failure, heart disease, stroke, and loss of toes, feet, or legs. The medical cost and the cost of lost work and wages for people diagnosed with diabetes account for hundreds of billions of dollars each year. In fact, medical costs for people with diabetes are more than twice as high as the costs for people without diabetes. The good news is that you can help prevent or delay type 2 diabetes. And preventing type 2 diabetes can be more cost-effective than treating the disease, the consequences of the condition. Further, most of the complications that I just mentioned can be prevented through healthy eating, active living, and maintaining a healthy body at any size. Next slide, Sarah, thanks. Those statistics are really sobering, and many of you might have already known them, but I like to mention them as they really tell us the story that we're trying to capture. They represent a huge opportunity for public health to implement ways to reduce the impact of diabetes, not only for the population as a whole, but also for each individual who experiences it. CDC has really led the way by creating the National Diabetes Prevention Program, or National DPP, Lifestyle Change Program. Congress authorized CDC to expand the National DPP to communities across the United States in 2010. This decision was based on the science of the original Diabetes Prevention Program research study and subsequent translation studies, as well as on rising concerns about type 2 diabetes and the growing numbers of people with prediabetes. Through the National DPP, CDC is working with partners across the country to build a national delivery infrastructure for a lifestyle intervention proven to prevent or delay the onset of type 2 diabetes in adults at high risk. This lifestyle change program is a year-long support system that helps participants make health changes in their daily lives. There are 3 major components to the program. First, the program is led by trained lifestyle coaches who teach participants new skills, encourage them to set goals, and motivate them throughout the program. Second, program participants are enrolled and placed in small groups or cohorts. This allows participants to share ideas with each other, celebrate each other's success, and encourage each other throughout the program. We find that this approach helps participants stay motivated as they make lifestyle changes. And lastly, the program includes a CDC-approved curriculum. The curriculum covers topics on healthy eating, active living, and stress management. Furthermore, what sets this program apart from other diabetes prevention resources in the market is that the National DPP Lifestyle Change Program is offered only through organizations that meet CDC standards. This allows CDC to ensure program quality and maintain fidelity to the scientific evidence. In terms of our vision for the program, we would like to see CDC continue to expand the National DPP. Together with our many partners, we are working to increase enrollment in this effective intervention among people at risk for developing type 2 diabetes. Our efforts are focused on eliminating barriers to access, like the inability of people to pay for these services or find a program locally or online that meets their needs. We have worked with employers over the past few years to gradually break down these barriers for US workers who are at high risk for type 2 diabetes. And with the launch of Helm, as Sarah will talk about in a little bit, we hope to accelerate this momentum. And the work with the Employer Learning Collaborative really accelerated that as well, as we combined state health departments working with employers. And we want to emphasize the importance of payment and coverage for the National DPP Lifestyle Change Program. We've secured Medicare coverage nationwide and Medicaid coverage in approximately 27 states through a variety of ways: demonstration projects, pilots, actual coverage. Another area that we're prioritizing is employer coverage of the program. And why is it important for employers to get involved with the National DPP and ultimately cover the program? Public health is most successful when we can reach people where they live, work, and play. We recognize that almost half of Americans get their health insurance through an employer-sponsored insurance plan, which makes employers important partners, both for increasing access to the program and for reaping the benefits of the program. I mentioned earlier that people with diabetes have healthcare costs that are on average more than twice those of people without diabetes. That means that employers have an incentive to help their employees avoid developing this condition. In addition to helping reduce future healthcare costs, the healthier lifestyle gained by participating in the National DPP Lifestyle Change Program can lead to higher productivity and lower absenteeism. Total worker health is defined as policies, programs, and practices that promote efforts to prevent injury and illness to advance worker well-being. We think the National DPP Lifestyle Change Program fits well into that definition. Furthermore, a lot of work has been done in advancing the employer-public health partnership, as I mentioned, with the Employer Learning Collaborative, and NACDD has played a big part. Through this work, we know that benefits professionals and leaders believe in the importance of prevention and the evidence behind the National DPP. Our job is to make it as easy as possible for employers to tailor a benefit to their specific population's needs in an inclusive and equitable way. It's also to implement the program in a way that keeps participants engaged. And finally, it's to monitor how the program is doing against their goals. And all these three will be covered when Sarah talks about the Helm platform. And that's where we believe Helm can come in. Our goal is to create awareness about this no-cost resource. As the number of employers who cover the National DPP Lifestyle Change Program grows, more and more Americans will have access to the program and learn to make a lifestyle change that can help them to prevent or delay type 2 diabetes. We'd like to see everyone make preventing type 2 diabetes a priority, not an afterthought. This could be with your own employee population or with employers you are in a position to influence within your community. Any and all of the above could be in action. We'd also like to see everyone here today go check out Helm, and once you get a taste for it after Sarah shows you, hopefully you'll do that, and see all it has to offer and find out for yourself what this tool can do for you. And finally, I would like to ask that you use your expertise and experience to help us strengthen and improve our efforts. Let us know your thoughts about our approach to working with decision makers and benefits managers, employers such as yourselves. We want to hear from you so we can adapt our approach and make it as effective as it can possibly be. Now, we want to talk more about Helm and give you some details about what it is. And to do that, I'd like to hand it back to my colleague, Sara Hanlon, who is a consultant with NACDD and has spent much of her time for the last few years planning, designing, and building out Helm. Sarah, take it away.
Thanks, Parul. So that's the problem that we are facing, right? We know that prediabetes is a challenge. We also know that for many of you, prediabetes may not be top of your list, but we're confident diabetes is up there for you. Before we get into the specifics of Helm, I just kind of want to do this crude activity a little bit with you guys and ask for you to take just a moment and think about your population size, your total workforce number. Take 10% off the top of that number. Again, that's not an exact number, but if we're looking at those that are already diagnosed with diabetes and are in hopefully your diabetes management programs, we're going to take those off the top. So again, your total workforce minus that 10%. Of those that remain, 1 in 3, so 33% have prediabetes. So this is something that is real for your organization. This is something that is preventable, and we can stop that transition to type 2 and all those complications and challenges that Parul just shared. So sometimes that can be helpful, and I think just really brings it home to our own organizations and work sites. So hope that was helpful for each of you. Again, when you do go out to visit Helm later, you'll be able to see places where you can plug in your actual numbers and get a little more scientific with it. But I think that's just an easy way to think it through. So, okay, so we know there's this opportunity to really stop that movement and that bend that trend a little bit towards type 2 diabetes and all the costs that are associated with it. But we also know that wellness and benefits professionals are getting hit day in and day out with opportunities similar to this. You've got a lot going on, a lot of other things that you're trying to balance. So how do we make sure that this program that we know works, that's backed by the CDC, built in evidence, has all the fidelity to the model, we're easier to get into the hands of employers? Again, that's really what we were gathering over this employer learning collaborative time. But now we were at a stage where it was time to automate that and make it even easier to continue to grow and spread that word. So out of that, Helm was born. The URL for Helm, and we will put this into the Q&A or chat a little bit later, is helmatwork.org. So you can see how Helm is spelled here. Again, it's helmatwork.org. And this tool, again, was really created to help you prioritize and implement diabetes prevention within your organization. We hear a lot about all the great efforts that are underway around diabetes management and chronic condition management. We spend a lot of time really reiterating and kind of making the case that that's not where we're at with this. We are getting ahead of it by prioritizing that diabetes prevention and risk reduction piece. So we've talked about most of this already. I won't spend a lot of time here. Really, this coming again out of that public-private partnership and what we were learning through the Employer Learning Collaborative. We engaged over 300 employers during that 4-year period and tracked and trend and noted everything that was happening along the way. Shout out to our evaluators within NACDD and CDC that kind of helped us synthesize that information and take pages and pages of narrative and figure out what does that really mean for what is the clearest pathway forward for diabetes prevention, and how do we really make sure that we've put these steps in the right order to make it as easy as possible to tailor your benefit. So even with the investment of time, resources into this web platform, it's really important for us that it is not just an online tool, but that it's a lot more than that. So specifically, some of the kind of wraparound supports that we have built out, a Helm guide. You heard us talk earlier about the role of the state health departments and that intensive 18-month technical support and education and training. Those individuals have now kind of gone alongside with us and are also trained in how do we best use Helm to support our employers. Is it sitting down with you in your office and going through the tool and making those decisions? Is it helping connect you to additional outside resources that can support you with this? helping you get your hands on your data. What does that look like within your organization? But having somebody at the state level that you can turn to help you with this process. Again, this is free of charge. Network of employers. We've continued to grow the ELC employer network. We are now over 200 employers that we're reaching regularly with events and newsletters and updated information that we are sharing out. The network for us is really an opportunity to bring similar employers and similar individuals together to hear what's working, to hear what those successes look like, and also what those challenges can be. And then finally, continuing education. We believe, again, because prediabetes may not be at the top of your list regularly, that there's an opportunity for us to continue to talk about what that really means and what that looks like and what the opportunity is for you. So we are offering ongoing continuing education opportunities. So there are really two fundamental pieces of Helm that I'd like to touch on today. The first one is the Helm program pathway, and that's what you see here. I'm not going to read through these, but you can see kind of the progression from the beginning of understanding the impact of diabetes prevention on your organization through understanding what the program options are, how to identify eligible participants, enrollment, leadership, evaluation. So really all the way through to implementation and sustainability. As we were developing this and talking to other employers, what we really heard was, we don't want a tool that just helps us understand how to get started with this benefit. If we're doing this, we want something that's going to support us all along the way once we have the program in place to make sure that it's really effective and achieving what we intend for it to achieve. So that's why we really, again, go from just the beginning of estimating the impact all the way through that sustainability. And we've created it in such a way that we hope that you'll be able to keep coming back for more information and connections over time. So within the program pathway, this is really where a lot of those key decision points are housed. So within these various steps, there is enough information for you to be able to quickly kind of identify where your organization may fit and which decisions may be best for your diabetes prevention strategy. We allow you to enter that within Helm so that you can track and update that. So if you, for example, under program options, perhaps you decide that you want a program that is offered both virtually as well as an on-site offering for some of your employees. That's where you would kind of learn more about that, make that decision, and then be able to go back and modify that over time if you chose to. And then the second piece of Helm that I really want to highlight today, there we go, is the Helm dashboard. I will say we are actually in the process of revising this right now to make it even more user-friendly and more valuable to you as you begin your program. So the dashboard is meant to give you an at-a-glance look really at why you're doing this, first with the cost and prevalence information, and keeping top of mind the dollars that are going out towards type 2 management, to make sure that you're getting the right people into the program and that your enrollment numbers are where they need to be. And finally, giving you a place to really monitor program success. We know that many employers will say, you know what, this is too much. I don't need to know this much about my program. My vendors are handling this. But we also know that others may find this useful in being able to perhaps share with leadership or just have a better handle on really how your dollars are, what that value on investment is for the dollars that you're putting out. We've also built it in a way that allows you to have someone else enter information on your behalf. So really helping build out those relationships and partnerships and opportunities where you may not be the one that's tracking your program progress, but this would give you an easy opportunity to come in and take a look at it. Okay, I think I'm going to take a breath for a minute. So that is, in a nutshell, a little bit about Helm. We're happy to go into more detail on that with anybody who'd like to set up a further demo, or if you'd like to go ahead and visit Helm at work and create your account and learn a little bit more. We'd love to have you on board. David, thank you so much for joining us today. Uh-oh, this one does not have David's slides in it. Sarah, I'm going to let you take care of that. But David, again, thanks for agreeing to join us here today. You and I have been doing this together for a little while now, it seems. There we go. I just had to keep clicking through. I'll let you reintroduce yourself. We've talked a lot since that introduction at the beginning of the call, so I'll let you go ahead and jump in and share your journey in Colorado.
Great. Thank you, Sarah. And thanks to NIOSH and Parul and the CDC for inviting us. My name is David Shapiro. For those of you joining with a variety of options today, I am a white male in my mid to late 40s. I have dark brown curly hair. I have a clean shaven face, and I'm wearing a navy blue button-down shirt and gray plastic rim glasses. My Zoom background today is the mountain ranges of Colorado with the Colorado School of Public Health logo, and I'm joining you from the University of Colorado Anschutz Medical Campus in Aurora, Colorado. Our center, the Center for Health, Work, and Environment, is one of 10 centers of excellence, academic centers of excellence. We are located within the Colorado School of Public Health, and we're one of 10 centers of excellence for total worker health, and we also house the Mountain and Plains Education and Resource Center, the MAP-ERC, one of 18 centers of its kind supported by NIOSH. Our specialty is employer engagement, and we are considered a business influencer based on our over 10-year history with our signature public health outreach program, HealthLinks. As Parul mentioned, it's really important for businesses to understand that they are part of the community to address and to prevent and manage chronic diseases. And because we have such deep relationships with business and the trust is already built, we're able to have some of these conversations about how to bring employers into the mix. So I want to share with you two things today. One is our employer engagement strategy, and two is a case study on how the University of Colorado approached diabetes prevention. There's a lot of words on the screen right now, and the print is small. We are going to share these slides, so I acknowledge that. But the goal here, and what I want to talk to you all about, is specifically our dissemination and implementation strategies. So let's say you're working with an employer and you're able to make the case that there is a problem. Type 2 diabetes is perhaps acknowledged by the organization that employees are at risk. They've gone through some of the tools with Helm. And I should say I was on the Helm National Advisory Council for the last few years and continue to advise on that project. It's a terrific tool and very robust. So let's put a couple check marks next to the employer engagement that you've done. One, the business recognizes that there's a problem. They've got the education, they've got the information. Perhaps they're seeing diabetes medication rise to the top prescribed medications for their healthcare insurance claims, or they've done the employee risk test with their employees. Two, the company understands that evidence-based programs exist, and this is really important. As Parul mentioned, the CDC has recognized the diabetes prevention program and the National Lifestyle Program as a curriculum based in science and evidence. So let's say that you're able to convince and the company understands that this is the right approach to help prevent diabetes. Type 2 diabetes. So the next steps, and where we really focus in on, is how do you disseminate and implement them moving forward with covering the actual benefit? And we use three strategies. The first one is just general outreach, webinars like this one, education and training. I'm not seeing all the names of you participating on today's webinars, but you're probably familiar with the HealthLinks webinar series and some of the work we've done to explain and translate public health science around chronic disease prevention and management to the business community. So broad-based outreach. The HealthLinks program also has a general tool, the Healthy Workplace Assessment, that organizations take to measure and receive a benchmark or baseline score on their commitment to total worker health approach. So those are the two general categories. Then we go into individualized engagement. Advising and consulting is our technical assistance wing of our organization, where we go through the results of the assessment, or we take the education broad-based education into a much more personalized and individualized approach. In fact, many of the organizations in our network will have an assigned goal on their healthy workplace plan, healthy workplace action plan on helping employees prevent and manage chronic disease, CDPMP. We also have worked off of the backs of the terrific employee diabetes risk assessment tool to add one caveat to it when we send it out to our network, which is first, let us know where you work. So that we can start to build a profile for organizations, and this is a tool that's also available through Helm, about what their risk profile of their aggregate employees looks like. And then ultimately the goal is to have employers cover the cost of NDPP. Sometimes that's understanding that your current benefit program already offers it. So sometimes it's just education and awareness building. Other times it's working with human resource professionals, small business owners, chief financial officers to talk about the business case. The classic saying from Benjamin Franklin that investing or an ounce of prevention is worth a pound of cure, an ounce of prevention is worth a pound of cure, is, how do we get the business community to invest in prevention, to offer NDPP as a covered benefit, rather than waiting for employees to actually have diagnosed diabetes and the costs that are associated with that. So that sort of follows our general engagement and outreach strategy. I want to talk to you a little bit about the University of Colorado, where I work, and talk to you about their experience with the diabetes prevention program. So a few things to note about the University of Colorado, and these are statistics from a case study that we published on the University of Colorado in 2022. Over 20,000 employees with over 27,000 covered lives on the medical plan, the health plan, which is offered through the University of Colorado Health and Welfare Trust. The first thing that they recognized is that people without diabetes cost on average around $7,000 a year on the healthcare plan. And they also recognized that people with diabetes, type 1 or type 2, cost over almost $17,000 on the plan. So there's like a $9,500 difference in individuals. So there's a real economic driver and conversation here about people on the medical plan with diabetes versus those without. The next thing that they did is, and this was back in 2013, and based on some legislation in Colorado that requires employers to offer diabetes management education and materials to like insulin to individuals that have type 1. So they began by offering diabetes medication at no cost to all members on the health plan. And so all members that had diabetes. And so what they saw was there was really an impressive and a significant uptake on this offering, more than they had anticipated. And this inspired the university to start exploring the root cause of diabetes in its workplace. And they determined through that exploration that our plan members were not managing diabetes through lifestyle intervention. It was medication-based, and a lot of people were going from at risk of type 2 to having type 2 diabetes. So the next step, a year or two later, was the health plan started working with NDPP providers to actually implement the program. The way they did that is by hosting biometric screening events that included A1C tests, offering the NDPP to employees and their family members. And individuals who had that screening would receive the results of their A1C in the mail. It was a physical mailer with enrollment information of how to get enrolled in the NDPP. Recently, over the past couple of years, the university has transitioned to a solely online delivery platform, and that was due to employee preference of having that flexibility with the offering of the program. And as of June of 2022, there's some impressive statistics. The University of Colorado had offered NDPP at that time to over 2,000 plan members with an 81% average retention rate, a 76% weekly lesson completion rate, over almost 7 pounds average weight loss per participant over the course of the year participating in NDPP, and an 80% program satisfaction rate. We have a quote here from Erin Tillberry, Assistant Vice President at the CU Health Plan, which I think is a really important component of all this. What she says is investing in the marketing and communications for this program was highly successful for the University of Colorado. We encouraged, or the university encouraged, any employer that offered the NDPP to communicate about this resource and tool to their employees in a data-informed and a coordinated effort. I'll share a personal story as well. In 2022, I was diagnosed with prediabetes. And having done this work, I was wanted to find out more. And so I worked within the University of Colorado and the CU Health Plan and health system around how to help control my prediabetes, worked on a 8-month lifestyle intervention class, and then have been following up with the clinical intervention and the trial team here. And I'm happy to say that a year after that, I am no longer at risk for type 2 diabetes. So it is possible to change that trajectory. It took lifestyle changes, increased activity. It took a more recognition of my diet. A lot of us came out of COVID with extra weight carrying and the stress that went along with that. And so I just want to put out there that while you may have found that you're at risk, or the people that you're working with are at risk, these interventions do work. And I'm an advocate for prevention rather than having to intervene when things get more costly and more dangerous. So thanks for providing us with the opportunity to connect. Many of you already know our center, but also there'll be continued ways for us to connect, and my email address is part of the presentation as well. I'm happy to talk with any other organizations about how to do employer engagement and what we're starting to learn from the business community about, one, a lot of them already have this benefit. So how can they communicate and promote it better? Or two, and probably the more difficult conversation, how can we get businesses to invest, put budget and resources into covering the cost of NDPP?
Thanks, David. I think we have some time for some Q&A, and I see some in the Q&A chat, so I'll go there first. I think one of the questions was, and I think this goes to Sara, how are we able to see if a certain employer company is eligible for this program?
Yeah, the good news is you are. There are, however, some employers that it may be a better fit for. So any employer absolutely can look at the National Diabetes Prevention Program for their organization. What we have found is that it can bring the highest return for you if your company is over 500 employees, if you have direct access to those employees, so maybe they're a little more centralized, or if you have a rich plan that allows you to reach out into where those different locations are. There are some industries that we've also noted tend to be earlier adopters. Again, anybody can take this on. But what we've found really, our health systems, our universities, manufacturing, and government tend to really rise to the top as those who have embraced it initially. We're really excited to continue expanding into other industries. We're hearing a lot of interest from retail and grocers and some other folks like that. So I'm excited to see where that goes, but please, if you have interest in it, check out Helm. It's just a free sign up. So doesn't hurt to check out if it is a good fit for your organization.
Thanks, Sara. And then this one I think might be for Sara and David, but I think I'll let Sara go first. I guess you answered it. And this one goes to, I guess, maybe all three of us, and I can also start it. Has Helm been systematically evaluated as a workplace intervention, e.g. in terms of its impact on healthcare, costs, productivity, and morale, et cetera? So in speaking to National DPP, obviously that is an evidence-based lifestyle change program. From the DPP study, it was translated into this great program that's now gaining traction. Helm is a platform, and I'll let Sara speak more to that about its evaluation. It's still very new. So Sara?
Yeah, we didn't really talk about how long Helm's been out there. So we are just over a year, just under a year into this. So we actually launched mid-February 2023 with our public health partners, and then really started our outreach to employers by May of last year. So we are still relatively new as an online platform, but we have a lot of structures in place where we will be able to get to that information. And well, maybe not the productivity and the health outcomes piece. I'm not going to go too far with this, but we have an evaluation plan set up to help us monitor the effectiveness of this tool that's really meant as a strategic process for you. So, certainly identifying our employers coming to the tool, are they moving to coverage? Are they entering information about participation in the program and their population metrics? So we are continuing to trend that. We also have, as David mentioned, an advisory council that supports reviewing things like the feedback system that we have within the website and making sure that we're staying on track with the topics and the information that we're putting out there and just our logic behind it. So no formal evaluation of that piece, but again, it's all based on the national DPP, which has that strong evidence behind it. David, I don't know if there's anything you want to add to that.
Yeah, thanks, Sarah, and thanks, Parul. Thanks, those of you, Jim and Anne-Marie, for asking the question about evaluation. We are starting to evaluate, and we have a manuscript draft on evaluating the effectiveness of our engagement strategies. And while our engagement predates Helm, it really follows a very similar trajectory as what Helm has laid out online. As all of you are familiar, employer engagement is, one, a lot of work. It takes a lot of time and effort. And two, there is really not a one-size-fits-all approach, even if you're working with companies of the same size or of the same industry. And so we're just at the precipice of starting to understand how our broad general outreach strategy, what I laid out in that slide about employer engagement, how many companies have we been successful translating into the individualized engagement component of that? And then how many of those companies have moved on to either more systematically promote their own benefit or actually pay for the cost of coverage? Our deliverable on our work with the Colorado's Department of Public Health and Environment is to get employers to pay for coverage. And it's a lot of work. It takes oftentimes several years. We're working with some healthcare and other organizations that it's an 18-month to 2-year runway in order to get them to sort of launch the benefit. And with large institution, that's often the timeline. So as you can imagine, evaluating the effectiveness of the engagement takes persistence on our part as well. But stay tuned. We're working on a manuscript draft. We're in final phases of editing it right now on how effective our engagement strategies have been and what are the points of connection that have really gotten employers to move the needle into paying for coverage. So thanks for the question. And we're working on disseminating that information out as well.
Thanks, David and Sarah. So this one, I think, also goes to all three of us, but it's for David first. In the course of your work on coverage, did you partner with the state health department in Colorado?
Yes, absolutely. And we know of a lot of different partnerships around the country. They can look a lot different. Our partnership with Colorado's Department of Public Health and Environment and their underwriting of our employer engagement is to specifically, as I just mentioned, get employers to cover the cost of the NDPP. So their role is to help us make sure we have evidence-based resources, that we know who the certified providers are, but they also recognize that we're the ones that speak in business language and we're in this business influencer role. I know some of you around the country get to the point of working with a business and then turn them over to the state health department for actually getting the coverage and the program. We operate the other way. The Department of Public Health and Environment has empowered us to work directly with the business community, and our role is to get them up to launching the cohort. So we have a number of certified providers that we can connect businesses to that deliver the program virtually, in person. Many of them are based in Colorado, but some of them are national as well. And so our role is in getting the company to move the needle. So Department of Public Health and Environment helps with institutional, foundational, and underwriting support of the engagement. We work with the company to get them to launch the cohort and get them connected with the certified providers. And then the providers do their job for the course of the year. We're starting to find out a little bit more about these various transitions. And we're starting to get a little bit more involved in the process of making sure the NDPP providers are collecting data that we can report back to the employer as well. So we're getting a little bit more involved in that third element of the transition, but absolutely the Department of Public Health and Environment has been foundational for us moving this work forward.
Thanks, David. And I want to elaborate on that a little bit with the Employer Learning Collaborative that we've done over the course of the last 5 years, where we intensively worked with state health departments to have them work with employers. A lot of times these two spaces don't mix. And so it was a deliberate learning opportunity, not only for state health departments, but for employers as well, to learn more about the public health space. So in that time, we trained, I don't know, Sarah, was it 20 something state health departments to actively pursue working with employers and engaging them in the national DPP and public health, and therefore it gave rise to Helm to help with that process. So if you are in a particular state, may have already begun that work and be well versed in working with employers. So they're getting more involved, and not just national DPP. We're also looking at how we can get employers involved in other the management of diabetes as well as the prevention now. So Sarah, do you want to say anything more about the Employer Learning Collaborative?
Yeah, I would just add, kind of building on that, one of the first things that you'll run into when you sign up for Helm is a request for what state you're headquartered in. And the reason that we ask that is so we can connect you back to your state Department of Health and or the business influencer like David in the market that has been trained in this. So we have that hands-on guide support built out through these states and their partners. Over the time of the ELC, one of the things that we really learned is it is most effective in many markets when we have those public-private partnerships really on the ground, not just between the state and the employer, but also having a business coalition, a chamber, a center like you, David, somebody in the middle that can really anchor that work together. So that's another, a piece of advice for you guys. If you have a coalition that you're working with, many of them are already engaged. We've got folks all over the country that we've been working with for years, both at the state health departments and those local business organizations. So we are happy to continue to make connections.
And just also to close the loop on this conversation, and we have 5-year funding cycles, and in our current 5-year funding cycle, we're in year 1, and one of the strategies is to increase coverage of the national DPP, either through employers or Medicaid. And so we are continuing to actively work in this space, even from the CDC side. Another question that came through is an individual is wanting to learn more about the program. And I assume you mean Helm, or if you mean national DPP, you can even just simply Google National Diabetes Prevention Program and you'll get a host of information. There's the National Diabetes Prevention Program Customer Service Center, and you can just Google that. And that is kind of our repositories and a way you can engage with others who are working in the national DPP. And if you want more information about Helm, I think Sarah might have typed in the answer. Let's see, another question that came through is, we are a small healthcare staffing company under 50 active staff without a health plan, but trying to add to our benefits. The majority of our staff are mostly in the field with shifts and hours that can vary from day to day. Would this program work for us? We are in Louisiana.
I'm happy to chime in, Parul.
Sure.
Yes, the short answer is yes. There's a lot of different delivery options, including virtual, some asynchronous as well as synchronous options for content. So yes, the National DPP would be a program that would work for your employees. And I want to mention one other thing for this healthcare company. If you are evaluating medical plan providers and healthcare insurance this year in the next decade, talk to them about what their coverage of diabetes prevention programs are. Make that be part of the list of things that you're asking questions about your providers, because no two insurance plans are the same either. So if this is important to you as a purchaser, eventually, of a medical plan benefit, make sure that you understand what the chronic disease prevention and management benefits are in whatever company you're planning on work with. And for those of you in benefits, each year when you're talking to the medical plans about coverage and about what sort of additional benefits you want, ask them how they cover diabetes prevention programs. I think it's a really worthwhile conversation. You're going to find out some of you may already know what the coverage is, but if you don't know, my recommendation is to, as customers in this field and purchasing healthcare insurance for your members and your employees, find out what your insurance offers, or if you're looking at purchasing new healthcare insurance, ask the question.
Thanks, David. A similar question, if you have multiple locations across the country, can you choose to only work in one area? Difference between the benefits coverage across company and where we might want to engage employees locally. And I think Sarah had started typing an answer, but Sarah, feel free to.
I didn't know you could see me typing in there, Pearl.
Sorry.
Thanks. Yeah, I can take that first. And then David, if you want to jump in, we've seen many employers with multiple locations that have started with one site, even to the point of some of the cities and counties that have come on board as employers. So it doesn't have to be a huge geographic spread. I think you hit it in your comment that it may even be that some people in the same city are on different health plans, and you may be, I'm just making this up, your Aetna plan covers it and your Cigna plan doesn't, and that's okay. So it may be that you start with a smaller subset of your population. We walk you through all of that within Helm, figure out where you can really have the most impact, and then continue to build out and increase this program. That's also a great strategy if you are within an organization that may need to get leadership buy-in along the way to be able to start with that smaller subset of your employees and kind of get that data up front. David, what would you add to that?
Completely agree, Sarah. The last thing you mentioned is what I would touch on for this organization, especially if you want to have in-person cohorts. Once again, recognize that there's a variety of delivery options for the NDPP. But let's use the scenario of a company that wants to start with a specific facility of theirs in a specific state, because maybe you know that the employees in that specific location have a high predisposition towards or risk of type 2 diabetes. I'm a big fan of engaging in this work as a pilot program first, especially when you need to get executive leadership buy-in and support. Ultimately, you're going to be dedicating resources to this program in the terms of admin staff time. There may be some costs involved. Your employees may need to take some time off to participate in the program. Hopefully that's paid time for them to participate. So oftentimes it makes a lot more sense to say, hey, if we're going to launch in this one unit, let's consider this a pilot program. Let's see how effective it is, and then we can move into some other units as well. So it's one way to sort of, it's more than dipping your toe in the water, I will say that, but it's one way to like walk into the zero entry pool before saying we're going to offer this to all employees in every state, is to say we're going to work on this specific set of team members. We're going to see how that goes, see how effective it is, see what works and what doesn't, and then we're going to expand on that to a few more sites and then hopefully eventually company-wide. Really great strategy for large organizations that are multifaceted.
Thanks, David. And just with a couple minutes left, I just wanted to reiterate something about the national DPP, as I know there were some questions about effectiveness. I wasn't sure effectiveness of what, but with regard to the National Diabetes Prevention Program, the program itself, at the heart of it, is a partnership between public and private organizations to offer this evidence-based, cost-effective intervention that helps prevent type 2 diabetes in the communities across the state. And one of the key features of the National DPP is the CDC recognized lifestyle change program, which is a research-based program focusing on the things I mentioned, healthy eating, physical activity, that showed that people with prediabetes who take part in a structured lifestyle change program can cut their risk of developing type 2 diabetes by 58%. So it's a research-based, it's evidence-based. The program itself has been well established. And now it's we're trying to make that public-private organization partnership even more robust with the help of employers and organizations such as all of you on this call today. So I think I hand it back to Sarah to close us out.
Yes, thank you. A huge thank you to all of our presenters today. Thank you, Sarah, Parul, and David. Just a note that you are also welcome to send our office questions about the presentation if you have any at twh@cdc.gov, and we can connect you. Otherwise, we have our website, our social account, and a newsletter that goes out quarterly. So please feel free to connect with us in any of those ways. But otherwise, that is it for us. We really, really appreciate all of your time, presenters and attendees. So have a great rest of your day, week, and thank you.